Hi everyone, this is Dr. Stephanie Kamaya Reznick. I'm a board-certified internist and one of the medical directors for virtual primary care here at Oscar. In today's video, I'd like to talk about COVID and pregnancy. First, while we don't have a lot of data, we do know that being pregnant puts you at a higher risk for having complications or a severe course of COVID-19. That said, your overall risk in general of having a severe course of COVID-19 is still relatively small. Because of your increased risk, we do recommend that you take all the standard precautions very seriously. I've talked about these a lot in past videos, but just to remind you, they include wearing a mask when out in public, maintaining social distancing, meaning staying at least 6 feet away from others not part of your household, and frequent hand washing for at least 20 seconds. And if you use hand sanitizer, make sure it contains at least 60% of alcohol. Of course, make sure to stay away from anyone who is ill and may have COVID-19. Now, even though the pandemic puts a little bit of a different perspective on your pregnancy, it's important not to forget that you need to take care of yourself. Make sure to go to all of your OB appointments, do all the recommended testing. Don't hesitate to call your OB's office if you have any concerns. And if you think you're having a medical emergency, don't delay getting care because of the pandemic. It's really important for you to get emergency care as soon as possible so you can have the best possible outcome depending upon what's going on. The other thing to remember are vaccines. They're important in pregnancy. You should get your flu shot. It's recommended that pregnant women get a Tdap, which is tetanus, diphtheria, and pertussis for whooping cough. Vaccination during your pregnancy. This helps to boost the immunity to the baby so they are protected a bit against whooping cough. And now there's the COVID vaccine. While there has been some controversy if pregnant women should get the vaccine, now the WHO, ACOG, and CDC all recommend the vaccine for pregnant women. Of course, if any concerns, talk to your doctor. In general, when pregnant, it's always important to take care of yourself, and part of that means making sure you have a culturally competent physician or other healthcare provider who can take care of you and understands your specific concerns and needs. Make sure you write down any questions you have before you go to an appointment so you don't forget what they were. If, based on the office's COVID restrictions, you're allowed to bring in a guest, it's recommended that you do bring someone to your appointments. It's a good source of support, helps you not forget anything, and it can be kind of fun to share these special moments such as seeing the baby on the ultrasound or hearing their heartbeat on the Doppler. Don't forget to take birthing classes. There's a lot of them available online, so you don't even have to go out for them. When you're stressed out, make sure you have a friend or family member that you can confide to. There are also support groups online, especially for moms during the pandemic. And of course, make sure you rest. Your body's making a baby. It takes a lot of energy. Be kind to yourself. If you're listening to this and you're pregnant, congratulations. I hope this provided some helpful information, and I'll see you next time.